not apply to the baby with fresh lung with RDS. In that baby, we still don't go over 5 or 6 centimeters of water. Now, I have to say that there are no studies. So the only thing that we have is this experience from the COIN trial where they used higher CPAP and there were issues. Now, for the more chronic baby, the kid who is coming off a vent has been exposed to higher pressures, and for some reason, the risk of rupture, PIE, pneumothorax, in those babies is much lower. We see lots of pneumothoraces during the first 2 or 3 days in babies we ventilate. How often do we see pneumothorax in a baby who has been on a ventilator? So for some reason, these lungs are more protected. And on the other hand, uneven ventilation. So I think that it makes us see any side to 9, just a couple of centimeters above what we use normally. We then want to go to 12.
Working with people who are using 12 and 14. I don't have the curve. He knows that.
That is interesting because in a baby with bronchopulmonary dysplasias, higher PEEP levels during mechanical ventilation to maintain the airway distended. But again, this is a completely different situation. We are talking about a baby with chronic lung disease where, yes, you may have to use higher CPAP and where the side effects are much less.
And then what do you think, Dr. Bancalari, I'm sorry, because I've been working with people who are using 12, 13, 14 sometimes, just to avoid intubation. Do you think using that higher pressure is better than intubating a baby?
Excuse me, which population, which babies are those?
Extreme preterm with evolving lung disease, evolving chronic lung disease.
So they are chronic babies?
Yes.
Yes. Well, again, there is no data. I would be very careful to go to those very high levels because not only you may rupture the lung, but you may interfere with venous return and produce interference with pulmonary blood flow. So I would be very careful, but I cannot judge because there may be some babies with massive degree of airway collapse and with bronchomalacia where maybe that helps. I think that if you do it gradually and you are monitoring, you are sitting by your patient and watching what are the effects is wrong, I would be very careful because of the potential side effects.
I think I would evaluate high CPAP versus NIPP in a controlled manner. It'll take some time to have this data look out. I think we have to move on to the next session. I had this wonderful session. Thank you, Aziz. Thank you, Dr. Mai. Thank you, Dr.
Thank you very much, Razak. Thank you, Dr. Mai. Thank you, Dr. Bancalari.
Great.
Special thanks to Dr. Mai Abu Saud for conducting such a beautiful and nice.
You guys have done a wonderful job. You've done a wonderful job. You made you made it successful.
Okay.
Thank you.
Good to see you.
You